Just in relation to your opening statement from your Heart Foundation, there is 9,000 CVD deaths per year. How many, in relation to gender, how does that break down? Sorry, I'm probably putting you on the spot.
I don't have that figure off the top of my head. I know with stroke that the deaths among women are much higher than men.
In strokes?
In stroke.
Okay.
It can be, I think, something like 25 to 30% higher,
Right.
which is to some extent down to women's greater longevity than men.
Right.
In relation to heart disease, I'm not quite sure what the current
I'll come back to that. I'll come back to that. Yeah. Just in regards to social determinants, and I think this plays a huge role in relation to the overall health of anybody, and that's poverty is a huge factor. You know, access to healthcare is an enormous factor in relation to getting access, working conditions, lifestyle, stress. All them factors. How much of a factor, putting them all together plays a role in relation to, somebody that may have a stroke or have a cardiovascular disease?
Well, the death rate from cardiovascular disease in the lower socioeconomic areas is 2 to 3 times higher than in the highest. And when you look at things like air pollution, for example, that is more prevalent in urban inner cities, and that has a much greater effect in areas of socioeconomic disadvantage than in more sort of salubrious areas where people might live. Likewise, smoking rates are higher. Likewise, when you look at the designation of shopping in supermarkets and what's sold in different supermarkets, fast food outlets, that sort of thing, they tend to be more prevalent in, unhealthy food and drinks tend to be more prevalent in disadvantaged areas than advantaged areas.
So I think it's a huge factor.
It's an absolutely massive factor.
It's probably the biggest factor I would think.
Yeah, absolutely. When you look at the difference in smoking rates, the last time I looked, for example, 50% of women in the travelling community were smokers. Now that might have changed a bit since, but that's going back a few years. But that meant 1 in 4 women in travelling communities were dying from the effects of smoking.
Yeah.
So that's the level you're talking about.
And obviously, in relation to smoking in the last, say, decade has dramatically gone down. It's gone down.
It's gone down, yeah.
And obviously, that plays a factor in relation to cardiovascular disease. Has there been any kind of reflection in relation to, the percentage that have refrained from smoking? Is there any kind of reflection in relation to?
That tends to take a generation to watch through in terms of outcome. For example, there's higher lung cancer deaths among women now than there was because of a generation ago. More women started smoking, for example. Like in terms of in terms of where we are with smoking, the smoking rate among children is starting to rise for the first time in a generation, and we are and I think we can say reasonably confidently, as a result of the explosion in vaping, we are looking at potentially losing those hard-won gains. Since 1997. The smoking rate among teenagers fell from 41% to 13%. It's up to 14.4% now. And if you look at where is this happening, this is happening more in disadvantaged areas than in advantaged areas. There's no doubt about that.
Okay, thanks. Just in relation to Cree, in relation to your new mobile health infrastructure, how will that be kind of rolled out as such?
Thanks for the question, Deputy. I suppose this is part of a larger project that we're implementing across a period of about 18 months, thanks to a very generous legacy donation we received in the past 12 months. The mobile units we're sourcing, I suppose there's two of them principally. One is a large articulated truck size unit that's been custom built. It's a bespoke unit that, I suppose if you can imagine the size of an articulated trailer, the sides of the unit extend mechanically to double the footprint. So when the vehicle pulls up at a community event or a public event, it'll have space for up to 8 screening bays where we can do rapid health checks free for the public at large public events. The interior of the unit is also modular, so it can be used for education and awareness events as well, kind of set up theatre style for a larger group. So it's a very flexible piece of infrastructure. The commissioning time for that, we expect that to be operational in Q3 of next year. And again, we're working at the moment on sort of a rollout plan to get that out into communities across the country, because it's a significant tool for us, I suppose, to meet people where they are. We already do a huge amount of work in the community in terms of screenings and health checks at things like any sort of public events, gatherings, community days, marts, sports events, all of that sort of stuff. So it extends our reach into that space.
If that vehicle was outside the car park now, and one of us wanted to go into that vehicle, what would happen?
Typically, we'd have a range of checks at our public health events at the moment. So blood pressure check is always part of it. Hypertension is one of the leading causes of heart disease and stroke, and one of the major risk factors. We'd also typically do a pulse check as well, which can be a marker for atrial fibrillation. So it's a basic enough check. They get a consultation with one of our community health nurses. We're looking at the moment to see if we can scope it out with some more sophisticated equipment, such as an echo, to be able to do echoes within the community as well. But again, there's a resourcing piece attached to that, and a specialist skill set in terms of providing that service. So that's not fully scoped out yet. And I suppose just to add, in addition to that larger unit, we also have a smaller van size unit that has 2 screening bays, and we're going to use that for, I suppose, more rural areas, maybe harder to reach geographically, communities and that sort of thing.
And would these vehicles exist already in relation to, say, the HSE? Is there any kind of such vehicles now?
Not that I'm aware of. I know there are some smaller mobile health units, I think, in operation. I don't have exact details of that. But for the larger one, I'm not aware of anyone in the cardiovascular space of its kind in the country.
We've been running a mobile health unit for many years around the country, and going into disadvantaged areas, farmers' marts, that type of thing.
That's a great idea. You've found that very...
Yeah, it's turned up a huge level of undetected cardiovascular disease. All right, yeah.
Because I seen an ad a number of years ago, and it was in the NHS in Britain, and they done checks in supermarkets, just places where a lot of people frequent, and the amount of kind of screening and kind of detection they found. Because obviously, particularly men, they try to stay away from the doctor as much as possible. And I think, especially, in getting into locations where men, I suppose, can't shy away from being screened. I think that's very important.
Deputy, we've carried them out at a number of Ardeshna for different parties, and we've turned up politicians as well as men, you could say, because we've turned up a lot of people who've had to go directly to hospital after being checked.
Okay, and that's Yeah. And what could be detected in that mobile unit?
Well, things like high blood pressure, cholesterol, that type of thing, atrial fibrillation.
And what would happen then? What's the next step?
You go, do not pass go. Go straight to hospital and get the medical help you need.
Just if I could come back on that point, just to give an example of that, and one we had recently, just you mentioned about the shopping centre environment. We did a series of health checks across 4 locations for heart valve disease last September as part of World Heart Month. We had them in Galway, Limerick, Dublin, and Castlebar in Mayo. There's about 1,300 people seen across the 4 days, and there was stethoscope checks to check for heart valve disease, blood pressure checks and pulse checks as well. And of the 1,300 people we saw over those 4 days, 10% were actually referred on back to their GPs or referred on for further treatment. So it just shows you the incidence of disease in the community and the sort of impact that sort of opportunistic screening can have if you can go out and meet people where they are rather than expecting them to go and make an appointment and get checked and to be there for people.
Yeah, that's very, thanks very much. Thank you.
Just before we take the break, you were saying about the Ardeshna. Is there anything you want to share in relation to the heart rate in some Ardeshnas?
Do they have hearts? Do they have hearts?
Parties that have.
I think it was pretty. I think it was pretty similar across the divide.
Okay, thanks very much.